Some will say, oh, your child's tonsils and adenoids are really big, and that is why they have a breathing or airway problem. And then there's a different perspective on that. Your child has a breathing problem, an airway problem. That's why their tonsils and adenoids are big. The first way is just breathing through the mouth brings in the air directly into the mouth, and it will hit the tonsils and adenoids first and cause them to be irritated because the tonsils and adenoids are meant to receive the air last if we were breathing through our nose. So the child who's breathing through their nose, that air gets filtered, warmed, humidified, so that by the time it gets to the adenoids and the tonsils, those structures are meant to do like fine particular filtering of the air at the end stage. But when we breathe through our mouth, the air is brought in. We're going to call it dirty or unclean air because it hasn't been filtered, warmed, humidified. Next thing you know, that air hits the tonsils and adenoids and causes them to grow. Well, we mouth breathe, and all of a sudden what happens with mouth breathing is the diaphragm stops moving. Mouth breathers breathe with their chest muscles. When mouth breathers breathe with their chest muscles and their diaphragm stops moving, the pump that clears our lymphatic system stops working. When that pump starts working, the things in your lymphatic system, like the tonsils and adenoids, swell because they're no longer draining. Basically, you need to be a nose breather that has their diaphragm moving properly to have your tonsils and adenoids be draining properly to avoid them from swelling. Because the swollen tonsils and adenoids are a symptom, yes, they're big, and some people will say, take those out. It turns out the research will show that removing tonsils and adenoids for kids will be largely ineffective, and most kids will return to worse breathing as time goes on. Parents report an improvement in breathing initially, but then by 6 to 9 months out, they say, oh, the breathing's getting worse. And usually around a year's time, they'll say, oh, the breathing is the same as it was. The research will show 36 months after tonsils and adenoids are removed, the breathing is worse than at the start for the children who are studied. If the tonsils and adenoids are overgrown because of the mouth breathing problem, and the mouth breathing problem is from the smaller jaw size, how about we grow the jaws? If we can grow the jaws, we can restore the nasal breathing. If you can restore the nasal breathing, you get your diaphragm moving again. Once the air starts coming through the nose, your tonsils and adenoids have a chance to shrink. Once you're nose breathing, your diaphragm starts to move again, and as the diaphragm starts to move again, it pumps your lymphatic system out, so your adenoids and tonsils shrink. There is a very small percentage of children that will go through jaw growth and development and restore their nose breathing, but still remain with large tonsils and adenoids. That very small percentage of kids could pursue tonsil adenoidectomy after all of the jaw growth and development is established, after they are an established nasal breather, because now you know you've done everything you possibly could, and they haven't shrunk. In my own practice for the last 2 decades, that has amounted to less than 1 out of 100 kids. Less than 1 out of 100 kids need their tonsils and adenoids removed because we approach it differently. We grow the jaws, we restore the breathing, they shrink. I would recommend not taking those out first, pursuing the jaw development first, as treating the cause has a different pathway than treating the symptom.